In the meantime, caretakers and family members of people in home health care or hospice are concerned about the lack of access to a COVID-19 vaccine. Experts told us today that getting people who are homebound vaccinated is a serious issue that needs to be addressed.
Our over 65 vulnerable population, it is very difficult for them to get access at this time. There hasn't been a defined rollout plan for that population yet. This is controlled by the states. And while there is a second wave that includes these people, the actual ability to get the vaccine is still a limitation. So we're waiting to hear what that is going to be. Obviously, patients that I take care of in hospice and palliative care are the most vulnerable, and they need access to the vaccine, particularly those because they all have chronic illness, and some of them are the sickest people on the planet right now.
What kind of guidance can you give someone who is stuck in that position?
Listening to media outlets such as yourself to find out where these are going to be. There is a significant initiative to push the vaccine to the retail pharmacy outlet. And those are which is a good plan because they're so accessible to the local retail pharmacies. And so that's probably going to be where most people are going to actually be able to receive this vaccine.
Do you see a lot of the burden falling on maybe adult children?
Absolutely. Obviously, this population, some don't drive and they need transportation. And so it's a family effort. I mean, for this population. The problem is that some of these people don't have family members. Accessibility is the key. And because the vaccine isn't portable, there has to be a way for people to get to the vaccine. Ideally, a lot of vaccines could be taken to the home, could be taken to a person's residence. But with this vaccine, because of the limitations of the storage capabilities of it, that's not possible. So it's important to keep in mind that we must have a way to deliver the vaccine to like the homebound persons that need it the most.
And Dr. Michael Bond also says that seniors on the fence about getting a vaccine should consider the risks of continued isolation and the toll that may take on mental health.